you think about someone entering the crisis system for the first time, the family is like bewildered and scared and not sure what to do. So we've done a number of things to help them, including family trainings with some of our providers and just engaging them more effectively at the point of service. Another thing too is involving peer-and-peer supports.
We have over 900 employees. Over 350 of them are peers, and over 100 of them are navigators. So we shifted our whole personnel model to really be centered around the most effective elements, which are peers and navigators.
We've increased our observation capacity at our crisis reception facilities by over 100%. We've increased our subacute inpatient beds at these same facilities by over 50%. That's been a challenge for the last 20 years that I've been a part of this system. And the fact that we've been able to expand that level of care and that level of intervention is huge. By the end of this year, we will have facilitated 6 crisis intervention trainings with law enforcement, and this training has proved to be invaluable to help those patrol officers really understand what our folks with behavioral health challenges and struggles are going through on a daily basis, and help them intervene perhaps in a different way than they may have prior to the training. We're also working with Phoenix Fire. We've established a pilot program with 6 of their firehouses, in which we have dedicated a behavioral health mobile team to be able to respond to any calls that they've identified as being a primarily behavioral health related call within 20 minutes. So really what we're tasking our teams to do is to go out, assess what's going on, and try and figure out, is there something we can do to help this person be safe in the community and get them back into an environment that's comfortable and familiar, as opposed to a hospital.
And the problem is once they're there, the difficulty with getting an accurate assessment, but then triaging and placement in a more appropriate setting. Another issue is the system that we inherited had been pretty well managed from a financial perspective, but not necessarily from a clinical or member perspective. A lot of providers were doing good work in their own particular silo, but when the member had to transition, there was a really poor communication between different providers. There really wasn't the collaboration, and so people would stay in an emergency room indefinitely. I mean, the average wait time when we got here was 50 to 60 hours per member on average.
Last year, we took over 4,000 people out of emergency rooms. And if you do the math, for what it costs to be in an emergency room, multiply that by 4,000, multiply it by how many hours they normally, and days sometimes they spend in hospitals waiting for care, it's huge. What we're trying to do is to create a new continuum of care and do it more effectively, more efficiently, and at the same time reduce the costs of the system by making sure that these individuals are able to get what they need.
There is significantly more access to appropriate behavioral health intervention that is not relying on the community emergency rooms or law enforcement who come across a situation and, were these options not available, might have had only the option to take that person to jail.
It's a lot less expensive to do the right thing. And so when you look at our high-cost members, for example, they have huge numbers of emergency room visits and inpatient hospitalizations. And so by getting them to community-based services and the right provider for the right treatment at the right time, and getting them engaged and involved in treatment, we avoid that whole emergency room and inpatient circuit, which is really good.
When we are able to drive that awareness and that support system that we have worked so hard to put together, and that community member hears it for the first time and is completely blown away by what's available and how easy it is to access, that's an amazing experience, and it makes it all worthwhile.